Hey there everybody, this is Dr. Andrew Nolt with Inspire Chiropractic. I'm here with my son Nolan. He wanted to help me make this video today. I wanted to take a moment and make a brief video on ear infections. Reason being is ear infections is something that we see a lot of in the office, especially in children, that we're able to help through chiropractic and do it naturally. And it was actually inspired by this story. We have a young boy who recently started care in the office, and he was always getting ear infections, always getting sick. They kept coming back on different rounds of antibiotics, just more and more antibiotics. Eventually got surgery for tubes in the ears, which is a very invasive surgery that children receive these days. And the tubes fell out. Got another round of tubes in the ears, and the ear infections just kept coming back. And just about a month ago, he went into surgery. He got his tonsils and his adenoids taken out. And sure enough, a couple weeks later, he got sick again, and he had ear infections. So in order to understand how chiropractic is able to help with ear infections, we first have to understand a little bit about the anatomy of the ear and of the upper neck and the relationship between the two. Now, in a child, especially in an infant, we all have something in our middle ear called the eustachian tube. And in a child, their eustachian tube is actually, very parallel to the floor, very horizontal. And as they grow older, it becomes more slanted and more vertical, so it's easier to drain. But you can't rely on just gravity alone to drain. A lot of times what happens is the top one or two bones in the neck shift out of proper alignment, and it'll kink that eustachian tube, not allowing it to drain. So then it becomes an irrigation issue, right? And if it can't drain, the fluid builds up, and when the fluid builds up, it continually becomes infected. So, a lot of research shows, depending on the research that you look at, roughly 80+% of ear infections are viral. So what that means is taking an antibiotic for it is never going to fix the cause of the problem. And research also shows that, taking these antibiotics long term over many years, a child is 2 to 4 times more likely to develop things like asthma or allergies down the road. Okay, so that first bone in the neck, the atlas, C1, has a little muscle that attaches. A little spit up here. Good job, buddy. You're doing great. So it has a little muscle. It's called the tensor veli palantini, TVP. And what that does is that acts as the active opener for the eustachian tube. So if that bone slightly shifts, it can't actively open and it can't properly drain. So through chiropractic, we use a very gentle technique, especially on infants, especially on kids. There is no twisting, popping, no cracking. And what that does is that starts to realign the top, take the pressure off the brainstem and the eustachian tube, and that'll allow the tube to drain. Right, so at the end of the day, it's the difference between a temporary relief and more of a true sustained correction. Okay, and what we see today is that's something that parents are asking for. They want the natural route. In a lot of cases, they want true correction. In this boy's case, the story that I shared with you, he's been under care a couple weeks now. The pediatrician said that the ears are clear, there's no more fluid, and he's doing a whole lot better. And although it's common for children to have ear infections, it's definitely not a normal thing to have them. So chiropractic can definitely help. My wife and I decided to make this short video clip because doctor means teacher. And I believe that when we know something that can help people, it's our duty to share that. So I encourage you to share this. If you know anybody, please share this with them. Comment below if you have any questions. And I hope you guys have an awesome day. God bless.